Shivani walks more than 8 kilometers with her ailing mother for her routine medical checkup. Distances can be dangerous, especially for pregnant women. There is no primary health center in her village. There is a mud road connecting their village to the nearest town, but there are no buses. The only relief for the villagers in medical support is the mobile clinic that visits their village. It has rightly been said that India resides in its villages. Rural India reflects what India really is. Healthcare is an imperative prerequisite for human development and is an inseparable component for the overall well-being of mankind. Sadly, the healthcare in villages is deplorable. Devadurga is the largest taluk in Raichur district in Karnataka. It is also the most deprived district in the state. The 189 villages of the taluk are quite alienated from most of the basic infrastructure needed for decent living. The villages are densely populated, the people are largely uneducated, poor, and depend on agriculture for their livelihood. Ever since its inception in 1996, Don Bosco Devadurga has been in the forefront for the development of the poor and marginalized people living in these villages. In Devadurga, Don Bosco initiated a community health project in 20 remote villages and has created a remarkable impact in primary healthcare services and in educating and empowering the community for positive health behavior. There are around 2,500 families residing in these villages with a population of 10,232 people. The mobile clinic of Don Bosco renders primary health services in the village where no other healthcare facilities exist, neither from the government nor from private people. The medical team, besides treating the patients, imparts health education to the people and children in the school on hygiene, preparation of nutritious food, childcare and the use of herbal plants, etc. An ambulance is used by the medical team to visit patients in the villages. They use the ambulance to go for rounds daily, covering 20 villages in a fortnight. Regular medical checkup and nutrition programs for women and children in the villages. Distribution of multivitamin tonics for the children suffering from malnutrition. Well-functioning dispensary run by the SCC sisters. Regular medical camps are conducted in various villages so that the people living in remote areas are able to access health facilities. The patients who are in need of further investigation or surgery are taken to the district hospital. As a result of the intervention of Don Bosco, there is a very good relationship created between Don Bosco and the villagers. One of the greatest achievements of this project intervention is that it was able to assist many who were down with typhoid and other serious illnesses and restore them to normal health. The medical team was able to provide antenatal care, postnatal care and neonatal care for mothers and children who otherwise would not have survived. This has brought down maternal and child mortality rates in the villages. Our focus is on devising schemes that focus on special requirements of susceptible, hardest to reach populations and the marginalized sections of society. Thanks to the Conrad Foundation, we are able to keep this project running. Don Bosco has proved to be a lifeline for thousands. Health is not everything, but everything else is nothing without health. Let us together reach out to heal those who need us the most.